Morning, students.
Good morning, ma'am.
So, yesterday we completed different methods of repertorization using Boger Boningusen's characteristic repertoire. Today, we will going to discuss about the concept of totality according to Dr. Boger or Boger's concept of totality. So, in according to we discussed about Dr. Kent, about Dr. Boningusen, according to Dr. Kent, how we should form the totality. We give importance first to mental generals. First, we have to give importance to mental generals. General symptoms. Then we have to give importance to physical symptoms. In general symptoms, we should have to give importance first to mental general, then physical general, then which thing, then characteristic particulars. So while giving importance to mental general, how we evaluate the symptom, how we should arrange the symptoms according to their how in mind mental generals we should give importance first to mind, then symptoms related to intellect, then symptoms related to memory, then physical generals also there is some specific sequence was given by Dr. Kent, then how we should find out the characteristic particulars in the symptom and which are the characteristic particular symptoms, which are the common symptoms related to that disease condition. These things we have to take one by one, one after one, and the sequence how we should consider, how we should give importance to these things that was given by Dr. Kent while giving his concept of totality, while giving his concept of while giving his philosophy. Then Dr. Boning Hussain, all we know that he gave importance to complete symptoms, and according to him each and every while constructing the totality we have focus on completing each and every symptom as a complete symptom. At that time, if any symptom is incomplete, then we use the doctrine of analogy, which was advised, which was given by Dr. Boningusen. Then he also gives some points to understand the full picture of the disease, that is quiz, quid, ubi, cubus oxalis, then cure, cumodo and condo. So about all these 7 points also we discussed in detail while we are discussing about PTPP. Now, what is the concept of Dr. Boger about totality? According to Dr. Boger, totality is not the sum total of symptom, but it is logical combination of symptom that characterize the patient as well as individualizes the problem. So why we make totality? This is not the concept of only Dr. Boger, but while making the totality, first his concept was introduced by Dr. Hahnemann to make the totality, to make the portrait of the disease. So why we make the portrait of the disease? Why we make the portrait of the symptoms of that case? To individualize the patient. We make the portrait, we form the totality of the case to make the portrait of the case, to individualize the case, or to individualize what is the problem, what is the difference in that condition, what is the uncommon things other than common symptoms in that case. So to find out these things, we have to make totality. So it is nothing but, totality is nothing but the sum total of all the symptoms but it is not all the symptoms, but it is logical combination of the symptoms which characterize the patient as well as which individualize, which characterize the disease problem also. So while making the totality, we have to logically arrange the symptom so that easily we can able to individualize the patient as well as his problem, as well as while finding out the simillimum. This totality is very much helpful. And while making this totality, while making this portrait, every time there is some definite principle, there is some definite plan how to erect the totality, how to form the portrait. And the portrait is formed, the totality is erected according to the facts, whatever we found in the case, or whatever symptoms we collected from the case. According or from that symptom, we have to make the totality when we arrange these symptoms in logical, in proper way. A homeopathic physician, he always forms a portrait of the case by collecting the data from the patient. All we know, we collect the history or we collect all the symptoms of the patient in detail. And after collecting the symptoms, after collecting the data from the symptom, we have to, or the homeopathic physician, he forms the portrait of the case. We not only collect the data from the patient, we not only collect the symptoms from the patient, but at the same time, the attendant who were present at that time with the patient, it may be his friend, relatives, or as well as observation of the physician. So while taking the case, in case taking, we study these things in detail, that we have to collect the symptoms from the patient, we have to collect the symptoms from the attendants, the view of the attendant, as well as the observation of the physician is more important, because many times there may be exaggeration from the patient side, or our interpretation may get false. So the observation of the physician is, and observation, the proper observation should be there, so that he does not miss anything, as well as he does not become prejudiced, without prejudiced mind, without making any prior concepts about that person, about that patient. The physician should observe the patient, his behavior carefully. And by collecting all these information, when the physician, the homeopath arrange these symptoms in logical way, then we get the totality of the case, and we can able to find out the exact simillimum by matching the totality of the patient with the totality of the medicine from the materia medica, and we can able to find out the most similar remedy or simillimum to cure the patient. And totality is much more important, because it is the basis, it is the base of repertorization. Before repertorization, we have to make the totality, and with the help of totality only we can repertorize the case. So repertorization, before repertorization, forming the totality is necessary. Without formation of the proper totality, without formation of the proper portrait of the case, the patient the physician, he cannot able to repertorize the case and he cannot able to reach towards the exact simillimum. And the case, as we discussed yesterday, is in yesterday's lecture, that the case itself decides the method which we should follow for the repertorization. Because when we erect the totality, then erecting the totality is depends on three fundamental principles. Which are these three fundamental principles? First, we follow Boning-Hussein's method when we get complete symptom in the case. As we know, Dr. Boger, he was the follower of Dr. Boning-Hussein, and he also liked the principles, the concepts of Boning-Hussein. So when we get the complete symptoms in the case, and when we are going to repertorize with you by using the BBCR, then we follow Boning-Hussein's method, and we get the when we get the complete symptom in the case. Then, as any in any type of case, we can use this repertory for repertorization. If we get complete symptom, we can follow Boger's Boning-Hussein's method. Sorry, we can follow Boning-Hussein's method when we get the complete symptom. In the same way, when we get prominent mental general symptoms, physical general symptoms, as well as particulars in the case, at that time also we can able to use this repertory by following Kant's method of repertorization. Means, while making the totality, while forming the portrait, we have to use the Kant's method. We have to give importance first to mental general, then physical general, and then particular symptoms. And when in case we get prominent positive factors, prominent modalities, sensations, pathological symptoms, and location in the case, then we use Boger's method for repertorization. So, while making the totality, while erecting the totality, we follow these three fundamental principles. That means, when we get the complete symptom in the case, then we erect the totality according to Boning-Hussein's method. When we get prominent mental general symptoms, physical general symptoms, and particular symptoms, characteristic particular symptoms, then we use Kant's method while erecting the totality. And when in the case we get prominent positive factors, prominent modalities, sensation, pathological symptoms, location in the case, then we use Boger's method for erecting the totality in that case. Clear? Is it clear for everyone? How we erect the totality according to case? Is it clear? Yes, is it clear? Okay. Boger was great follower and student of Dr. Boning-Hussein. He helped the profession by putting all his experiences in the evolution of portrait of disease. As he was the great follower of Dr. Boning-Hussein, he used all his experiences, all his principles while making the portrait of the disease, while forming the totality. And he emphasized Dr. Boger, after studying all views of the previous homeopath, he emphasized the some 7 points to appreciate the whole picture of the disease. So, according to Dr. Boger, as we discussed in the methods of repertorization, that he gave more importance first to positive factor, then he gave importance to modalities, then sensation, pathological symptoms, location. In the same way, for making the portrait, he also have some concepts. He have given 7 points to appreciate the whole picture of the disease. So which are these 7 points? First point is changes in personality, changes of personality and temperament. So we have to focus, is there any changes in the personality of the patient, is there any changes in the temperament of the patient after the commencement of the disease or as disease appears. Then peculiarities of the disease. Is there any peculiarity? Is there any characteristic? Is there any uncommon symptoms in the case? Then seat of the disease. What is the location of the disease? Is it exact location of the disease? Is it right sided? Is it left sided? Is the symptom or is the location which or the symptom which starts at one place and then it go towards the other place or ends at other place, then is there any concomitants which are present with the main complaint. Then fifth one is what is the causative factor, is there any causative factor for the disease condition, which are the modalities, which are the aggravating factors of that disease, which are the ameliorating factors of that disease condition. Then is there any time modalities, is there any aggravations and ameliorations
मॅम,
in it? Yes.
तुम्ही स्लाइड चेंज करताय का?
नाही.
आम्हाला एकच स्लाइड दिसते.
एकच स्लाइड आहे, ते बाकीचं नाही आहे माझ्याकडे. ॲक्च्युली स्लाइड्स बनवलेल्या नाही आहेत त्याच्या टोटॅलिटीच्या, एकच
अच्छा,
स्लाइड
ठीक
आहे.
आहे.
Then modalities, then the seventh and last point is time. That is there any time related modalities, is there any time related aggravations or ameliorations present in the case? We have to consider these things in the same sequence. So according to Dr. Boger, while making the portrait of the totality, he advised to use these 7 points. The first one is, I again revise these things. The first one is changes of personality and temperament. While making portrait, we should consider firstly if is there any changes of the personality and temperament. Then peculiarities of the disease, is if any present. Then thirdly, seat of the disease or location. Then fourth one is concomitant symptoms. Fifth one is the cause of the disease. Sixth one is modalities, and seventh one is time. So according to these things, we have to make the portrait of the disease. So these 7 points are very much important, and Dr. Boger, he emphasized, he gave more importance to these 7 points while making the portrait of the disease. Dr. Boger, he favored the understanding of the whole phenomena at the level of constitution, diagnosis, and ongoing pathology. As we know, we discussed in under his philosophical background that he gave importance to all the pathological changes, and pathological changes means the changes which takes place at tissue level, and due to these changes there may be changes in the constitution which takes place. And also he gave importance to the diagnostic rubrics, which he also included in his repertory, because many times in advanced pathological condition we cannot get the exact or clear picture of the disease. So at that time these diagnostic rubrics, they are very much useful. Dr. Boger, he gave importance to causation, then time dimension, modalities, concomitants, general sensations. In that, first he gave importance to pathological generals. Location, which is given at the last place in order of hierarchy, and mind is given adequate importance, but he used the symptoms of mind while differentiating the medicine. In this way, Boger has given how the Boger gave importance to the symptoms that we discussed in the methods of repertorization. Then, and in that, we also discussed that location is given at the last place in order of hierarchy, and the mind is given adequate importance. And in his one article, some thoughts on prescribing, he instructs a physician to first try to elicit the evident cause and course of the sickness down to the latest symptom, and effect of such influences: time, temperature, open air, posture, being alone, motion, sleep, eating, drinking, touch, pressure, discharges, etc. So which things we have to elicit first? We have to elicit first the positive factor, the cause of the disease, as he given importance first to cause, then to modalities. So he asked the physician, he instruct the physician that while making the portrait of the disease, we should first try to find out the what is the exact cause behind that disease condition, and how the disease starts, what is the condition of the patient before disease, at the commencement of the disease, and how the disease get progressed, what are the symptoms when at the commencement of the disease, what are the symptoms, how the symptoms get progressed, and what are the latest symptoms. So, and what are the influences of the time, temperature, open air, posture, when the patient was alone, motion, sleep, eating, drinking, touch, pressure, discharges. We have to elicit all these things. We have to find out the effect of all these things. Is there any effect on the patient or not? So, to find out the evident cause, to find out the exact cause behind that disease condition, we have to find out, we have to ask the patient how the disease starts until the latest symptoms of the disease, how it gets progressed, as well as we have to find out the effect of all other influences. Is there any effect of other influences on the patient, so that the disease condition it may appear? So we have to find out that all the effects, or we have to find out all other possible things and their effects on the patient, which may be the reason for the present disease condition of the patient. Then, after causative factor, according to Dr. Boger, we have to consider the modalities. So, secondly comes the modality, and in that, consideration of mental state in order of importance. So, in while considering the modalities, the mental state, the modalities related to mind, they are important. Then thirdly, the entire objective aspect or expression of sickness, including the state of secretions, as well as it is called as sensation. So first one is causative factors, the evident cause. Second one is modalities. Third one is expression of the sickness, which we also called as sensations. And after sensations, the part affected must be determined, means the location. We have to find out the exact location, the exact part which was affected, and which also brings the investigation in touch with diagnosis. So to diagnose the case, the exact location of the disease is also important. And from his article, from his above article, that some thoughts on prescribing. It is obvious that Dr. Boger has given importance to causation, modalities, then general sensation and pathological symptoms or pathological changes. And he given the location in the last place in order of hierarchy. He gave importance to causation, and he says whether the causation come from without or arise from within. The homeopathic similimum we cannot able to choose with safety without taking them into account. Means without the causative factors, we cannot able to find out the exact similimum. About the modalities, he said that they individualize and define every sickness as well as every drug. Hence, most suitable medicine cannot be chosen while they remain unknown. Means to individualize the patient, to individualize the drug, and define the exact sickness of that patient, of that drug, we have to find out the modalities in that case. Then he gave adequate importance to mind, and his importance, which was he gave importance to symptoms of mind, which was shown from his article, How Shall I Find the Remedy? In that article, he wrote that the interdependence of mental and physical states is so great that we never afford to overlook it entirely. They, moreover, always clarify every other symptom, often in decisive way. As well as he advocates that every symptom should be valued as per the condition. So as he was follower of Dr. Boning Hussain, he liked the concepts of Dr. Boning Hussain, but then also he gave importance to mind symptoms as well. And from his article, How Shall I Find the Remedy, we can able to get that how much importance he was giving to mind symptoms, because he said that all the mind symptoms and physical symptoms, they are interdependent, and we can never overlook any symptoms out of these symptoms. That means while considering physical symptoms, we have to give importance to mental symptoms, as well as while considering the physical symptoms, we have to find out the what is the state of the mind at that time, before disease condition, at the commencement of the disease condition, and at present. So he know the interdependence of mental and physical state, so he gave importance to symptoms related to mind in while forming the totality. So in concept, Boger's concept of totality, you have to remember all these 7 points. These 7 points are very much important, as well as you should know about in detail why he gave importance in this sequence. Which are these 7 points? Once I revise, first one is changes of personality and temperament. Second one is peculiarities of the disease. Third is seat of the disease. Fourth is concomitants. Fifth is the cause. Sixth is modalities. And seventh is time. So in this way, while forming the portrait, according to Dr. Boger, we should give importance to these things so that we can able to form the proper portrait of the disease. We can easily able to individualize the person, as well as he also gave importance to symptoms related to mind. He said that the interdependence of mental and physical state is so great that we never overlook it entirely. We always give importance to mental symptoms while considering the physical one. Though he was the follower of Dr. Boning Hussain, then also he gave importance to symptoms related to mind, and while erecting the totality, as there are three fundamental principles. The totality, it may be based on three fundamental principles which we have discussed already. From that also, it shows that Dr. Boger, he gave importance to physical symptoms as well as mental symptoms. As Dr. Boning Hussain, he gave importance to mental symptoms only while erecting the only while differentiating the simillimum from group of similars. But while erecting the totality, if the case is having prominent mental general, physical general, as well as particulars, then Dr. Boger advised that while erecting the totality, we have to use Kent's method to form the portrait of the disease, or to erect the totality, we have to use Kent's method of repertorization, as well as he follow Boning-Hussein's method. He liked the principles, he liked the concepts of Boning-Hussein. So in his plan construction of repertory, in his philosophy, he gave importance to Boning-Hussein's concept, but then also he know, or he understand how the mind symptoms and physical symptoms, they are uh, interdependent on each other, and so he also gave importance to mind symptom. So this is the nothing but the Boger's concept of totality. So there may be question on short note on what is the Boger's concept of totality. It was asked for 5 marks, 10 marks, as well as give difference between Kent's concept of totality, Boning-Hussein's concept of totality, as well as Boger's concept of totality. So you should know According to that way also, in this lecture we also discussed in that way what is the concept of totality according to Dr. Kent, what is the concept of totality according to Dr. Boning Hussein, as well as in detail we study today about the concept of totality according to Dr. Boger. So this you have to remember all these things, and these 7 points are very much important while erecting the totality by using Boger's concept. Is it clear for everyone?